As we mentioned earlier, the new year bringing big changes to your health care under the new law. What will that mean for you and your doctor? Dr. Mark Siegel of the Fox News Medical Aid Team joins us here on the set. Happy New Year to you.
Greg, Happy New Year to you.
When our viewers walk into their doctor's office at the beginning of the new year or any time in the next new year, are they going to see a change in their service?
I think they will. I think there's changes for doctors and for patients. I think 2011 is the first year of the big changes rolling out. Now, for Medicare patients, that's going to mean that in January, they don't have to pay that $100 plus co-insurance.
All right.
We doctors aren't going to see that. So we might see more Medicare patients in January coming into the office. Preventative care and primary care doctors like me are going to be paid 10% more for visits, but that's only about $5. So I'll lose that $100 and I'll get $5 per visit back. Preventive services like colonoscopy and mammogram, that's going to have no copay. So I think you're going to see more and more patients flooding in to get those services. That's great, because I'm a big fan of preventive medicine. But, Greg, they're not paying doctors more to do that colonoscopy. So is the wait going to be longer? I think it will. I think they already cut the reimbursements down for those procedures dramatically, and I think it's going to be hard to find a doctor to do it.
Is this sort of the first step in the feared sort of rationing of care?
Well, it will be for sure if the doctors aren't available. We already have a physician shortage. Again, we weren't really factored into all of this. So the insurance is becoming easier to overuse, especially Medicare. But do we have the doctors? And then, of course, private insurance, the premiums are going up.
Yeah, that's what I wanted to ask you about. Are patients going to be paying more for either their insurance or their health care costs or both?
Well, I want to talk about that. There's no rule on that. But the problem is, in New York State, when we covered pre-existing conditions in the 1990s, the way that this law is starting to do nationally, premiums rose. And there's no caps on premiums. And instead, as Chris Carter said before, you have a situation where the insurance companies are being forced to pay 80 to 85% on services, meaning if you have a big turnover, you don't have enough to pay your administrative costs, you turn around and you raise premiums. So the premiums are going to continue to go up, and not everybody can afford that. The state exchanges don't come in until 2014.
Pharmaceutical manufacturers are going to see what sounds like a pretty sizable tax increase, $2.5 billion based on sales. Will that in turn hurt consumers because it invariably gets passed along to them?
I think it will. I think they counted on the fact that they were going to get more customers, and I think they will get more customers, especially as the donut hole starts to be closed. Right. So there's a trade-off here, and the pharmaceuticals made a deal with President Obama at the very beginning. But I think inevitably you're going to see an increase in cost for the drugs, especially since, by the way, technology is imperiled. We're not as sure if we're going to get as much money towards research for new drugs.
I was talking with a senior earlier today, and I said, well, look, there's going to be lower prescription drug costs for seniors, so there's good news for them, right?
Well, yes and no. There's no free lunch here. I'll tell you something. Yes, the donut hole is starting to be closed, but I want to make a point here. 50% discount on brand name drugs in that donut hole over about $2,500 where you used to have to pay out of pocket, but 50% discount on top-level prices. I mean, when insurance companies get a price for Lipitor or for Viagra or some drug, they pay about half price, wholesale. So they're already discounted 50%. Right. So seniors are paying half price of full price, and that's still high.
Flex spending accounts, which are sort of a wonderful device because they're pre-tax dollars. But they're now cutting back on that.
You know, I wish that was being expanded, because I think flex spending accounts and HSAs are a disincentive for overuse. If you have to pay out of pocket, even if it's taxed, you're going to be hesitant to pay unless you actually need the service. Now, over-the-counter medications are something that are not being covered by flex spending accounts. I'm going to have to prescribe aspirin and insect repellent and hemorrhoid cream. That's ridiculous. I don't have the time to prescribe that, nor does any other doctor. And I think it's going to cut down on the use of these very valuable accounts.
Squeeze a quick one in. Businesses can now apply for grants for wellness programs?
Love that. That's something that's coming in 2011 that I love. I think if they put in weight reduction programs, incentives for stopping smoking, they apply for grants, that may help for real preventive medicine.
There's so much in this thing, and you're going to be with us every step of the way to explain it. Dr. Mark Siegel, as always, thanks so much.
Thanks, Greg. Thanks a lot.